audience is here. I'm Dr. Mikel Delgado, and I'm here today with...
I'm Victor Carpio, Director and Inventor of the Dental Wand.
Nice. Okay. And yeah, just to tell you, those of you who do not know me, I'm a cat behavior consultant and certified applied animal behaviorist. I've been working with cats for over 20 years, and we're really grateful to Base Paws for hosting us today. It's going to be, I think, a little bit of a conversation more than like a formal presentation. And those of you who are here, you signed up to talk about what's causing stress in your cat. We're going to talk about that. We're going to talk about dental issues. We're going to talk about pain. We're going to talk about the environment. I do like to remind people, neither of us are veterinarians. I'm not that kind of doctor. So if you do have specific medical questions about your cat, or you ask us a question that's medical, we may refer you to your veterinarian. And certainly if you're having an emergency, turn off your computer and call your veterinarian right now. But yeah, we try to stay within our lanes, but we will be presenting a lot of information about the basics of dental health and dental care for cats, stress reduction. Hopefully I have some time to answer your questions. And I don't know, Victor, you want to add anything?
Yeah, I completely agree with you. This is more to just broaden your understanding of your cat, of what could affect your cat, and then you can relay that information if you do detect any issues better to your veterinarian.
Perfect. Okay, and definitely let us know in the chat where you're coming from. I see a lot of people from all over. We've got Wisconsin, we've got Michigan, we've got London, New York.
I see a London there.
Yeah, nice. So we're international too. I'm in California and Victor's in the UK. So we're excited for everyone who's either up early, about to eat dinner, maybe it's lunchtime. But yeah, thank you for being here. And yeah, I see, wait, did I see Germany? I see Germany. Pretty cool. Arkansas.
Wow. Oh, I'm Poland.
Canada.
Saudi Arabia. Wow.
Yeah, cool.
That's cool.
All right. Well, I think we'll just get started chatting, and occasionally we'll pop up a few slides, but like I said, this isn't going to be like a formal, like you sit back and look at slides. Oh, and we might have some polls. Do we have any poll questions?
I think we do have some polls. If not, we can ask the questions and the people can answer in the chat.
Oh, that's a great idea too. Okay, so do we want to start with a poll? I don't even remember our poll questions. We have poll questions.
Yeah. I'm just quickly trying to get it up.
Okay, so while we're doing that, yeah, I see people already have burning questions. So you can put your questions in the Q&A. You can, someone asked, can we turn on the closed captions? So hopefully that is happening behind the scenes right now. Let us know if it's not, and we'll do our best to get that turned on for you.
Yes, Michael, I did find them.
Okay, great.
And I think a nice one to start off with, because we're going to, I believe we're going to start about understanding your cat and behavior basics, is to ask the audience, have you had any issues with stress and your cats as far as you're aware of?
Yep, so great. You can put those responses in the chat. I see people with already saying they have burning questions. So yeah, while you answer the question of like, have you had issues with stress in your cats? Someone wants more light on your face. Victor, do you have a little?
I think I do, yeah.
So we'll just start by talking, I'll get started by talking about kind of behavior basics, right? Which is things that maybe you don't know about cats, but that are very important to who they are. And, I think for many of you may recognize that your cat is a natural predator. And even if your cat is indoors and gets their food in a bowl, that is still a very innate part of their existence. And when we see play behavior, that is their hunting behavior encapsulated. But there's a lot of other instincts that are present in cats, like staying clean, scratching, covering their waist in the litter box, that can sometimes cause conflict in the home, right? So we have cats that don't use their litter box. We have cats that maybe are biting and scratching people in the home. Maybe cats that are, well, another thing that's really important is how cats interact socially. And when we have lots of cats in the home, as many of us have more than one, I think Victor might be the one in the minority here today, right? You have just one cat, right?
Yeah, I do. Yeah.
Okay. So, cats are on a spectrum of sociality. So some cats are very social with other cats, and other cats are not so social with other cats, don't appreciate the company of other cats. And the sorts of things that allow cats to congregate naturally outdoors. So a lot of what we know about cat relationships is from studies of feral colonies. And when you look at those feral colonies, what sustains them are having resources, space, and choices about whether or not those cats have to be in proximity to each other, right? And so in our own homes, you can imagine we see a lot of conflict with cats that are forced to coexist in a small space without enough resources to support them. So not enough litter boxes, not enough separate feeding areas, not enough climbing structures, not enough kind of safe spaces where they can kind of avoid each other if they want to and choose to be together if they want to as well. And I think a lot of us hope that our cats will be friends if we have more than one cat. But it can cause a lot of stress if the cats do not get along. And sometimes that leads to other problems. And, an important thing we'll be talking about today as well is the cat's health, right? That's critical to living a low stress lifestyle. But a lot of people find it stressful to properly care for their cats, right? Like taking them to the vet, getting them in the carrier. We're going to talk about a big one, which is dental care. And not only can, it be stressful to try to brush your cat's teeth every day if you don't have a plan, but if your cat is suffering from any dental pain, then that can cause stress as well. So yeah, I think when we think about cats, think about them as socially flexible, think of them as a natural predator, think of them as clean. They have needs to mark their territory with their claws and their scent glands. They need outlets for their energy. They need things to keep them busy. And they need to, feel like they live in our home with us. So it is, we're territorial too, but for cats, it can be if you don't give them the things that they need, they will shred your couch, pee on your bed, do other things that may be undesirable to their humans.
Right, exactly. And that is the first step, understanding their needs, which I believe can really be encapsulated nicely in the fact of play, in the fact of your interactions with the cat, in the fact of resources. And those, I guess, were the three main pillars, at least that I'd say, that pay attention to. And then once you start looking at those or understanding those pillars, you can look at the environment that your cat is in and try and find those triggers.
Yeah. Have you made any changes to your environment since how long have you had your kitty?
So Lilo has been with us for 6 years now. Okay. So he actually does suffer from stress. A lot of what you see is if cats don't have, we mentioned living in multi-cat households, and something that I wanted to add to your comments, which I thought was really interesting, is that if cats don't have those earlier chances to socialize, that also affects the way that they will socialize when they are an adult. For example, my cat, we found him in a sewer in Peru. Yeah, I know, bless him. And he never had, God knows what trauma he had when he was a kitten. I mean, he was this big, like handheld size when we found him. But he can't socialize with other cats because there wasn't any chance, he might have never had brothers or sisters, who knows. But then the changes that I made to my home to help facilitate Lilo's stress condition is vertical space. So if you don't, and that's a really good solution if you don't have the horizontal space. Say you live in a studio flat, right? Yeah. Think up.
Thank you. Yeah, so many people are like, oh, my apartment's too small to get a cat tree. I'm like, you don't understand. The cat tree will vastly increase your space from your cat's perspective, right?
Yeah.
And they don't take up that much.
Right?
Yeah. Yeah.
Yeah. You'll see if you don't have a cat tree, you'll see your cat climbing the curtains, They're climbing the counters, climbing their bookshelf, for example,
Yeah.
they need to express those instinctive desires, and they will do it one way or another.
Yeah, absolutely. Yeah, we have 4 cat trees in my house. So
Nice.
I think this is actually the only room that doesn't have a cat tree in it. But so yeah, I think number one, like it's such a worthwhile investment for your cats to give them that vertical space. And and there's actually been research that showed, I know we're focused on like dental health today, but there was a study in South Korea that showed that cats who did not have vertical space in the form of a cat tree or shelving were more likely to have lower urinary tract disease than cats who did have vertical space. So that's a lot of lower urinary tract disease in cats is directly impacted by stress. So so again, kind of a primo example of like pretty like simple thing you could do. Get a cat tree, put it in a window or somewhere where your cat will enjoy it. Cats love to sit in the sun. They like to watch birds, and you will, see it like impact their life for sure. So
100%. I think a really good way of understanding, do I need more cat trees if you've already got some, is maybe seeing where your cat is climbing, and if to you that is undesirable behavior, and then maybe you should try and consider putting in some furniture which would be appropriate for your cat. Funny enough, this happened to me, but not with cat trees. It was with my cat scratching some of our kitchen chairs. So we have in our home around 6 cat scratchers, which isn't cat trees related. And what we found once is that Lilo, my cat, he just started scratching my kitchen chairs out of nowhere for no apparent reason. My dad did recently move in during that time, so I believe that is what triggered him saying like, "Hey, Dad, you're coming into my realm." And obviously that is undesired to me because the chairs will be ruined in the future. So a really nice way, and I'd love to get your opinion on this, is 3 steps or 3 ways that you can change undesired behavior, which is usually stress related, if I'm not mistaken, or stress expressions, would be firstly distract. So when your cat is doing the action of scratching the chair, distract. So usually with a noise, I like to click, something loud and something that isn't really associated to you. I wouldn't usually do that noise when I'm talking to Lilo, so you kind of want to avoid him associating the unpleasured noise with yourself. Then you would disrupt the action, again, always positive, in a nice friendly tone, and then redirect onto the apparatus or the furniture that you would want him to express that behavior with. And that's what I did with the cat scratcher. I added one next to the chairs. When I saw Lilo scratching the chairs, I would make the noise. I would say, "Lilo, no, baby, this way," and I would redirect him. And at start, I would even put his paws on it, and then he understood, like, "Oh, okay, this is
okay." Well, that's where I'm going to disagree.
Okay, cool.
So I'm very much like hands off as far as not like because some cats really don't like having their bodies handled or their paws handled, and so you could create an aversive experience. So you have to be really careful. I'm not saying it didn't work in your case, but in general, I'm kind of the if you build it, they will come. So like I might approach it a little backwards, right? Which is the first is just making sure you have amazing scratching options, exactly like you said, near the chair. And when your cat does use what you want them to scratch, reward the heck out of them, give them treats, praise, give them attention, right? Because so many cats scratch furniture for attention, right? They're like going up to the chair, they're like, "Who are you watching me?" And they're like, because they're bored. So again, like thinking about like, why is the cat scratching in the first place? Like, and this is a really important thing because a lot of people think cats only scratch to sharpen their nails, and that's really like the least of reasons that they use to scratch furniture or hopefully cat furniture. They're scratching to stretch their back muscles. They're scratching to stretch to mark their territory. They have scent glands in their paws. It's also, as you hinted, it's a good outlet for stress. So we see this as what we call a displacement behavior. So you will see cats scratch things, maybe, after they get in a little tussle with one of their roommates, or they fall off something. Oops, I'm going to go scratch this and kind of get this out of my system. So we do see in response to stress, and we also see them do it at like maybe high emotional moments, like when you get home from work, right? Your cat runs over and like getting their scratch on. And so it can be like a greeting behavior. It can happen after a nap, after eating. So yeah, I think, the steps you outline, which is like, make sure you give them something appropriate to scratch. And that's where a lot of people, I think, go wrong with cats, is like they try to suppress an undesirable behavior without looking at the why and giving the cat an outlet for the behavior, right? So the why could be your dad's arrival. It could be they don't like the scratching post you're offering them because it's too short or wobbly. It could be that there's stress in the home. It could be that they just want to stretch after they nap. So we try to identify the why first and make sure their needs are getting met in a way that also meets our needs, hopefully. I mean, I think there always has to be compromise. And I talk to a lot of people who are like, oh, I don't want to have cat tree. They're ugly. They want to have 4 cats, but they don't want to have any vertical space in their house because they don't want to look like they live in a house with cats. I'm like, you gotta, give in some way. So, but great examples of like environmental changes that you made for your kitty, and a super important one. It comes up a lot. Now I do want to, so we talked about, some aspects of stress. Maybe we should shift a little to talking about pain, because as I hinted, a lot of cats, I think, are experiencing pain. Sometimes people don't know how to recognize discomfort in their cats. I think a lot of cats are kind of have a reputation for being stoic, hiding pain. And so I do want to show a couple of slides, which are basically some tips on identifying pain. So let me see if I can get my PowerPoint to share. Okay. Is that working? I can't even tell.
That is, yeah.
Okay, good. All right. So let's start with, the context, which is, let me do the slideshow.
Oh, I think you're muted, Michael.
Thank you.
No
we good?
Yeah, we're good.
How long have I been using Zoom now? Okay, so as I mentioned, cats are notorious for hiding pain. Part of that is because, even though they're a predator, they're also a prey animal. And so we believe that they try to hide any signs of weakness that would make them vulnerable. And I think a lot of times we actually kind of downplay pain or discomfort in our cats for various reasons. I think sometimes it's just they're afraid to go to the vet, or they don't want to go through the stress of getting their cat to the vet, or they don't want to deal with like an expensive vet bill. But, we really have to pay attention and take it seriously because it really impacts your cat's quality of life. If you can imagine anytime you've been in pain, it's not fun. So I really have to pay attention to signs. I did want to talk about the types of pain. So you can have acute pain. This is like a sudden onset. So this would be a cat who broke their leg, or they just had surgery and they've got a surgery incision that's been stitched up, and maybe when their anesthesia wears off, they've got discomfort there. Or there could be some medical conditions, but it's generally a short-term pain.
Sorry to interrupt you, Michael.
Yeah.
I think some of the slide is covered with give subtitles a try. Might be on the. I'm not sure if you're using 2 screens, but
I am using 2 screens.
Maybe I think it's sharing your other screen.
Oh, sorry.
That's okay.
Try this again.
It happens. The amount of times that this happens to me. So I just thank you for someone who commented. I would have noticed if not.
Yeah, thank you. Is this better?
I think so. Yeah, it's changed.
Okay, cool.
Yeah.
Okay.
Yeah, cool. Thank you. They've said cool.
Yeah. And then the other type of pain is chronic. That's like a persistent discomfort. And this can actually be much more stressful to an individual. It can affect their immune system. And this would be, like cats with degenerative joint disease, or even dental pain that is not addressed, right? This is something that doesn't go away. And that can be a huge, huge stressor for cats. And I will say, one of the reasons that I like to talk about pain as a behaviorist, even though I'm not a veterinarian, is just that the most common sign of pain is a behavior change in your cat. So if you're seeing changes, they're suddenly hiding, They're not enjoying things they used to. They're not jumping for their toy anymore. They're spending more time in bed. They're not grooming as much. They're not using the litter box consistently anymore. We might see some postural changes. So this cat in this photo is demonstrating a classic pain posture, which is kind of hunched into a bunched up position. They might be suddenly sensitive to touch or bite when you touch them, maybe when they didn't before. I mean, some cats are touchy, but and then personality change. So these are all things that sometimes people dismiss, like, oh, he's got a behavior problem. And it's like, this is why I emphasize so much with my clients, you need to go to the veterinarian before we treat this as a behavior problem, because we need to rule out a painful condition. And just a couple more slides, which is just some clinical tools for assessing pain. So there's been a lot of research into pain in cats, and just, you know, like usually they use cats who are coming out of a spay surgery. So no cats are harmed to assess pain, but they test like different medications for pain to see how the cats respond usually. And so some really good ways to identify pain from a cat's face are the distance between the tips of their ears, basically how open and relaxed their eyes are, and how much tension you see around their face. And the tool that has gotten, they actually have an app now, is the feline And you can see these cats in different kind of stages of and amounts of pain. So in the case of the cat on the left-hand side, this cat is not painful. The ears are facing forward, their eyes are open and bright, their whiskers are loose, the muzzle's relaxed, and the head is upright. And as the cat becomes more painful, you can see the ears become more pulled apart and rotated. The eyes become more closed and tense. And also we see more tension in the muzzle. And the head becomes lower, right? So now this cat's head is below or at his shoulder line. You know, this is just like a starting point for you. And these are not necessarily going to be like, you know, one thing about this tool that's very nice is that it's been shown to be very reliable and easy to use, and it has a lot of consistency between users. So if when you use this tool and I use the tool, we'll both kind of rate a cat the same.
I love that. I've written felinegrimscale.com as well. Gonna check that app out.
Yeah.
That's it's a nice since we're talking about pain, I think it'll be a nice transition to also talk about what dental pain is like.
Yeah.
So the most common dental disease that you're going to find in your cat is periodontal disease. I believe this then followed by tooth resorption, which is it's got two types of tooth resorption. One is both are believed to be related to or created by periodontal disease, although the T2, which is the second type of tooth resorption, is still quite unknown. I won't get into that too much, but periodontal disease doesn't start off as periodontal disease. Your cat isn't just walking one day and then bam, you know, there's some mouthful of periodontal disease. It's a progressive disease, and really importantly, and what is really nice in a way, is that it is completely reversible at the early stages, because at the early stages is actually gingivitis. And now I'm going to share some visual aids to really understand what gingivitis and periodontal diseases are. So I'm probably going to have the same issue. Okay.
It's working.
Right. Yeah. Okay.
Perfect.
Cool. So yeah, gingivitis, you have 4 different types of gingivitis, or 4 measurements of gingivitis, which is called the gingival index. So gingival index 0 is healthy gingiva. You have pink gums, very similar to what we have. There is no redness, no swelling. When you touch it, it doesn't bleed or anything like that. Healthy gingiva, clinically healthy gingiva is gingival index 0. Gingival index 1 is slight redness on the gingival margin, which is where the teeth meet the gums, as you can see on the top right photo there. Then you have gingival index 2, which is a bottom left photo. As you can see, there's already a little bit of swelling. Yes, it's a lot puffier. And the way that they mark this is that when it is probed, there will be bleeding. And then the final level of gingivitis is the most severe, and that is very severe swelling. Some of the gums is kind of bluey, reddy, and the bleeding is just spontaneous. Then we get periodontitis. So periodontal disease is almost like a every villain story that you see, like the Joker or like Star Wars with like Darth Vader or something like that. They all start friendly and nice. Periodontal disease just starts as general bacteria in your cat's mouth, which is both good and not necessarily negative. It's when the bacteria accumulate and start creating a biofilm, which is essentially just like a wrap. Imagine all the bacteria holding hands. That is a biofilm, and they start running round the teeth and getting thicker and thicker, and the oxygen reduces in your cat's between the teeth and the plaque that is forming, and that's when you start getting the really negative and not good bacteria, the anaerobic bacteria that create toxins into your cats. And it's actually that toxins and your cat's immune response to that toxin saying, hey, stop coming in, that it inflames itself. And that's when it starts creating gingivitis. And it's the gingivitis, constant swelling, constant infection, constant swelling, a vicious cycle that leads to periodontal disease. And it is the periodontal disease is the destruction of the structures that hold the tooth in its place. If you imagine like a tooth being held by a spider web in the middle of a spider web, and periodontal disease is just bing, 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 slowly plucking each and one of those little strings that is holding the tooth in place. And that is caused by your cat's immune response. The inflammation of the gums is actually the ones that destroys the collagen, that destroys the bone around it. And the signs of this pain, like you said before, Michael, is very behavioral parts. That's probably the best way to detect periodontal disease or gingivitis at home, because it always happening under the gums. To really get a definitive answer or diagnosis, you have to go to the vet. And that is the only way to do it. But if you look out for behavior changes like drooling, like not eating their food or having some hesitancy in food eating, that's a really big one. Cats will still eat. It's a part of their life. They have to do it to survive, right?
We talked about this, I think, last week, because so many people like, oh, he's still eating, he's fine. And I'm like, I have a cracked tooth right now, and it's like very sensitive to hot and cold. I can tell you, I'm still eating.
Yeah.
I need to get a root canal, but in the meantime, I am eating, even though it's uncomfortable.
Yeah, exactly. I like slushies, and I've got sensitive teeth, so I go through the pain to enjoy the sushi. And you're completely right. Cats will still eat, and that's honestly why it's very difficult to diagnose if you're not aware, because to the average Joe, they're still eating, they're still playing, right? But if they're eating with hesitancy or chewing just on one side, or almost like acting like a Hoover and trying to avoid chewing, those are some really good telltale signs that your cat might be having some dental pain. When I just mentioned playing, if your cat is playing with a toy, say his favorite toy, he always loves to chase it, then bite it, and then start bunny kicking it. But now when he does the biting and he drops it out immediately, that again is another sign. It's because the pressure that your cat is used to putting on their teeth is not bearable anymore, because the structures holding that tooth is being destroyed and there's being affected. So talking about the infection and destruction of the tooth, receding gums, that's and bad breath, constant bad breath, right? So if you just give your cat tuna and your cat comes over to you and gives you a kiss and you're like, whoa, it has to be constant, right? And then I guess like loss of appetite, if it does get very severe, you can really get to some cases, if it's like stomatitis, where it's like really crazy swelling of the buccal surfaces, so the cheeks of your cat, then they might not be grooming as much anymore. I saw that someone mentioned something regarding grinding as well.
Yeah.
And grinding could be dental related.
Yeah.
With drooling, you'll usually see grinding with drooling, but in those cases it's again very important to go to your vet, because you can't outline neurological factors or like gastrointestinal factors. So always speak to your vet in that case.
I want to, because a few people said like, well, how can I tell if my cat has dental disease, and you know, so the most important thing I think you can do is take your cat for that regular yearly physical exam. If they're under 9, once they hit 9 or 10, they should be seeing a vet for a checkup at least twice a year. So that's all preventative care, once a year, at least for young adult cats, and at least twice a year for older cats. And because, it can be hard for us to see the signs. Someone mentioned like, how do I stick my hands in my cat's mouth? Sometimes it's not a good idea. So, you know, and you're not going to necessarily be able to diagnose dental disease in your cat. So, you know, I think, you know, seeing a veterinarian, getting a referral to a dental specialist if needed. One of my cats, when she was young, had a dental malformation. So we had to kind of wait and see, but she was on her way to, you know, the dentist and possibly kitty braces. So there's, you know, lots of things that can go on in a cat's mouth. Someone asked about resorptive lesions. I know we briefly talked about stomatitis. I mean, some of these conditions are like autoimmune, so it's even more complex than just the mouth. But I think the other thing that's really important to recognize is when the mouth has a lot of bacteria and infection in it, that doesn't just affect the cat's mouth. It becomes a systemic problem that impacts all of their organs and can become very dangerous, even deadly. So, I really feel like, you know, if you're not sure, or you're seeing any signs of pain or discomfort or other weird, I mean, I can't tell you how many people come to me. I'm not a veterinarian with, you know, my cat's like X, Y, or Z. I'm like, go to the vet now. So always start there. It's like, that's the best place to, you know, like I said, know what you're dealing with, and then you can have a plan.
And your vet will always check the cat's mouth, just like you said, because it is so. Some oral diseases is part of it can lead to systematic diseases and complications, and vice versa. Some oral conditions are due to systematic problems, and I guess since we are talking about the vet and we are talking about stress. It would be nice to touch upon, I think it would be really valuable, ways to make your cat less stressed or go into the vet, or that pre-going, during and post.
Sure. Yeah. So one of the most important things you can do is help your cat learn to love their carrier. There's actually been research. There's research that shows if your cat is trained to like the carrier, basically what that means is you leave the carrier out all the time and you feed them treats in it and put bedding in it and make it a nice cozy place, that the cat cries less on the ride to the vet. The veterinary exam is faster. The cat struggles less. Their heart rate and respiratory rate is lower. So there's lots of benefits to getting a carrier that you love, your cats love, and like I said, feeding them in it, feeding them treats, playing with them in it or around it, put some catnip toys in there, put some nice bedding in there. You can see a vet who is part of a cat-friendly practice or a fear-free handling certified practice. So going to veterinarians that are sensitive to what cats need during a veterinary exam in regards to like what kind of handling they use, like not scruffing and using towels and making sure, you know, the space is quiet and calm and they're not like next to a cage with a dog in it.
It makes a big difference.
Yeah, absolutely. And like they use towels on the steel exam table. They're not just putting the cat right on the table, which I've had happen to me at like emergency vets. So those kinds of things really do matter. I go to a cat only practice because they see just way more cats than a general practice veterinarian would. So those are some things you can do. Now, your veterinarian may recommend a medication to give your cats before the vet visit that helps them be less stressed out, slightly like calming, sedating. It's going to make the experience much more relaxed. And you can also look into a mobile vet. So if your cat is really that like stressed out at getting in the carrier and in the car, or it's stressful to you, then see if there's a veterinarian in your area that does home visits. That's not going to be appropriate for everything because they can't bring an x-ray machine to your house or like, but certainly for most yearly checkup type stuff for a young, healthy cat, it's definitely a good viable option.
Yeah, I agree. I think two major things in helping that transition or that journey towards a vet, pre, during, and post, and with anything really, and especially oral care, take it slowly, always keep it positive, be persistent, and just really always reward when they're doing things, you know, that little steps, you know. So for example, making your cat carrier the part of the furniture and playing around it, feeding it, that's making that positive. And then you can try and get your cat inside of the cat furniture, inside their home where they feel safe and they've already had that bit of trust with the cat carrier. Maybe close the door of the cat carrier for a bit, let them out immediately.
So nothing bad happened, right?
Yeah, exactly. And the cat's like, oh, it's not always doom, it's not always hell when I go into this box. And that is completely the same thing when it comes to oral care. A lot of the times we find out that our cat needs treatment and a home care routine when they're already an adult, you know, when they've already got issues at home, and your vet is like, you need to start cleaning your cat's teeth
every day.
Every day, yeah. Just like, oh, I got to sleep with an eye open. My cat is going to be there over the bed with like a knife, right? Like, and we worry because we don't want to put that strain within the cat bond. So a lot of the times, toothbrushing is the gold standard when it comes to maintaining that good hygiene of dental care. And but the issues with toothbrushing is that it requires some degree of technical ability, cooperation from the cat, and motivation from the owner, all of which is interrelated, right? If one drops, the others are going to drop. So when we do start, or if you do decide to start brushing your cat's teeth with a toothbrush, start off small. Just get them used to the taste of the toothpaste, which is usually animal flavored, right?
Yeah, they do make a variety of flavors depending on the brand. Chicken, mint,
chicken,
turkey,
fish. It's my cat actually loves the taste of the Verbac toothpaste. So what I use with him is this. Sorry, it's a little bit bold, but this Verbac and
I need to try that one because my cat's only one of my cats likes the current toothpaste we're using.
It's a lot of the times you will go through like hit and miss, trial and error when it comes to flavors. But once you find the one,
it should be like a treat, right?
Exactly.
It should really be like a treat.
Yeah. My cat thinks it is a treat. So I started actually doing, because I taught my cat how to sit, lay, do paw and stuff like that. So we go through those actions, and then I actually use the toothpaste as his reward because he just thinks, hey, this is nice. He doesn't think it's toothpaste. Then once you start doing that and your cat has that positive association with the toothpaste, it's now time to, when it goes to lick it off your finger, try just rubbing it on their teeth, on the front teeth. So just quickly regarding the cat's mouth and their teeth, you've got three uses for teeth and three sets essentially of teeth. Teeth are used for prehension, mastication, and weapons. So prehension is holding stuff, which is the incisors at the front. Then the weapons are the canines, the big dagger tooth, and then mastication, which is the premolars and molars. So you just start off with the incisors because they are, and the canines because they are the closest to you. And get him again or her used to your touching, and make it positive, make it rewarding. Then you start going a little bit further back if possible. And after they feel comfortable and you can get a whole range of mouth and yourself feels comfortable, get a finger brush, get a toothbrush and do the same. Start off slow. Let him sniff it, let him identify it.
I would make sure we clarify, like, use toothpaste for cats not
Not
human toothpaste,
human.
and also get a toothbrush that's designed for pets. So they make ones either that are very small, like, or you can use a baby toothbrush. So they come in different styles, but they're usually small, soft. And I agreed with, like, I loved your approach. That was exactly what I would say. So
Yeah, with cats, with anything. So even if it's at home, the stress at home, or with the stress when you're trying to do oral care, the stress comes because it's a change in their routine if it's something new, and they feel like they can't usually control that, right? Like, would
yes,
you? Yeah,
control
like,
is a huge word in my vocabulary when I'm talking to cat
yeah,
owners, because I think we all want a sense of control, and it's very true
100%.
of our cats. They want choices, they want a sense of control.
Yeah,
And unfortunately, I think people get very like, I have to do this and I have to do it now and I have to do it every day. So therefore, I'm going to turn to like holding my cat down or forcing the issue, which
yeah,
99.99999% of the time is going to backfire and make things worse. So
yeah.
I want to highlight the term cooperative care for those of you who are interested in training and want to kind of take it further. I would encourage you to look up cooperative care, because it is it's more of a philosophical approach to training pets, where they're basically giving consent for you to brush their teeth, usually, or whatever, giving them a pill, grooming them, usually through a trained signal where they say, if I rest my chin on this ledge, or I offer you my my chin on your hand, or etc., I consent to you going to the next step, which might be putting your hands in my mouth, or brushing my entire body. So to me, like, as we become more educated about animal welfare and behavior, and as we become more educated about training and husbandry, these are techniques that they've been using in zoos and sanctuaries for years. I mean, they look in the mouths of hippos and they give lions blood draws with consenting animals, right? They train them to consent to these techniques. And so we can use these techniques with our pets as well. So I just want to encourage those of you who are interested, like, Google cooperative care, and you'll see a really interesting world of trained animals that give their consent to be medicated and have their teeth brushed and be groomed and handled. It's really amazing.
Yeah, I'm glad you mentioned cooperative care, because that leads nicely onto the dental one, really. And I'll quickly introduce that. So I was like everyone else. I had a cat. Find out he was 3 at the time, Lilo. Found out that how difficult it was to brush their teeth, because I was just thinking, I'm such a bad cat dad. I need to save your teeth. Let me save your teeth. And Lilo's just like, nope. And no cleaning was done. Frustration just stained the room there. And frustration led to myself. So for the past for 2 years almost, I was working with the help of some individuals from International Cat Care. They helped me, they guided me on the development of the dental wand, which is essentially it's essentially a wand toy that is specifically designed to brush your cat's teeth. Now, the nice thing about this is that it introduces the factors of play, where play is, like, Michael, is super powerful when it comes to introducing changes, when it comes to creating positive associations. Would you agree with that?
Oh, absolutely. Yes.
Yeah. If you, for example, if you're moving home, playtime with your cat is a great way to get them accustomed and feel that trust and create those positive associations with your new home. So if we incorporated play into brushing their teeth, then we are creating these positive associations when the cat is brushing their teeth. What better way? Yeah. Yeah, I love it too. What better way, right? What better way of, like, telling your cat this is safe. And the nice thing about that is that we talked about how toothbrushing requires technical ability from the owner, cooperation from the cat, and motivation from the owner. The dental wand now ensures cooperation from the cat. It doesn't require any technical ability, so you can just jump in and use it, and motivation is up, because who doesn't like playing with their cat, right?
I hope so. I hope that everyone wants to play with their cat, because that's I think I mean, when I heard about your product from one of my friends at Base Paws, I was like, I need to meet this guy because this is the coolest idea. And because I, just like everyone else, struggle to brush my cat's teeth. I use like someone asked, what is it? It's the dental wand. So I don't know if you have a prototype to show off, but
yeah, I do, of course.
my approach is a multi-layered approach to dental care, which is really trying to tackle the problem from as many angles as possible. So toothbrushing, using toothpaste with my finger, using a Q-tip, using dental treats, water additives, any and everything that I can do so that even if I'm not brushing my cat's teeth every day, like most days I'm doing something to improve their dental health, right? Even if I can't, because like everyone else, it is, it can be difficult. And, like I said, ideally everybody's brushing their cat's teeth every day, but it's tough.
Yeah, it is. I mean, but that's what being proactive in looking after your cat is, doing something, and you do have various options. Like you do have the dental treats. You can put some, you can start training with toothpaste and trying the toothbrush. The dental, are you
going to show us the dental wand?
Yeah. So the dental wand comes as your regular wand toy, right? So but the special part is the actual toy itself. So the dental wand is made out of food grade silicone A60, so it's very bendable. So the reason for this is if your cat already does have signs of gingivitis and periodontal disease, it won't cause that extra pressure and damage towards it. Also food safe, so not toxic to your cats. The way it works is that you would open it up one of the sides, and in one of the cavities you would put in your chosen toothpaste. So in this case, my cat's choice of toothpaste, after a lot of trial and error, I'm not going to lie, was this Verbac toothpaste. And then after that, you would close it back up. When closing it back up, you can also fill this other side with some more toothpaste if you'd like, or you can fill it with some catnip if you wanted to help that that new interaction. With some older cats, we found that it works as well. Talking about older cats, the nice thing about this is also that it doesn't age discriminate. So we've had cats from 1 year old kittens to 14 years old play with the dental wand. Then and what you see at the start, you would, once closing it up, by the way, you would just play regularly with your cat, and the cat would do the rest of the work. So because you're acting on their instinct. So what we were speaking about before with that, the need to express instincts, you mentioned that hunting and play was one of them, and that is true. So the dental wand engages in your cat's instincts to hunt. So they when they are playing and they're looking at the dental wand moving around, what's going through the head, also just got caught there, what's going through the head is, this is not a toothbrush, this is a bird that is now in my house, and I'm going to go through the predatory sequence. I'm going to hide, I'm going to wait for my moment, and I'm going to pounce. And what we've seen is that positive associations are created during the first try. So even if your cat doesn't bite it in the first try, it will get more confident, and usually by the 5th and 6th go, the cat is just going over to it by itself, to the dental wand by itself, and biting it on by itself. And the beauty of it is that the bristles are designed to get under the gingival sulcus, which is where plaque can accumulate, and that's how gingivitis is formed. And the toothpaste is only expelled upon pressure from the bite, which this side it is. It was in this side. Pressure from the bite. Yeah, so it won't cover your house in toothpaste. And again, it's being very subtle. So when a cat does bite it, it's being subtle, and it's also helping in that predatory instinct, because when a cat does bite it and thinks it's doing that winning kill, the toothpaste, which is flavored, will add to that belief that the cat is thinking, hey, this is a nice bird I just hunted, right?
Yes.
And would bite and go through all the layers, because it would use this canines to kill. It would then use the premolars and molars to masticate, and it would use the incisors to grab it on later on. So that is the beauty of the dental wand, and that is a alternative solution to brushing.
Okay. I'm going to stop you for a second because we're getting some questions, and I also wanted to address one thing that came up in my mind. One is, just so people are aware, you can't cure periodontal disease with either toothbrushing, dental treats, or this wand. Your cat is going to need a cleaning. And when the perfect time to start a new care protocol is after your cat has recovered from a dental, or if 100%. You're lucky and your cat does not need a dental, then start now. But once your cat has severe periodontal disease, you're not going to be able to treat that at home. So it's just to be aware. And then the other thing, we're getting a lot of questions about the product. So someone kindly posted the Inventor Cat website.
Oh, thank you.
And can you, so it's not available yet, but coming soon, correct?
Yeah, so start of August, create production. So hopefully by the 27th to 30th of August, we now have a date, which is really good. Yep. It's going to be ready for launch. So what we're doing at the moment, we're actually doing a giveaway, if I may. So what we're doing, we are getting people to join our private Facebook group, where it's me, where you can talk directly to me. Yeah, Michael's there as well. So join us. It's called, I'll pop it on the chat, and also you will get it, I'm sure, in an email following this, but it's called the Dental Wand Cat Care Club. So we talk about, if you have any issues, you can post it on there. We can help you out as much as we can, but again, like Michael said, we're not veterinarians, so we can guide you on the best solution, but the veterinarian will be the one who makes the decisions. But essentially, also we'll be posting content regarding cat care that who doesn't love. That's why you're all here, right? And everyone who's joining from this webinar onto our group in Facebook will be entered into a raffle to win 2 dental wands when we do launch. And if you invite more friends once you've joined, those are more raffle tickets. So that's what we're doing to just help support and everyone who is in the group, even if you don't get chosen for the raffle, is going to get like launch day discounts just for being a loving supporter.
Okay. So we have about 6 minutes left, and we still have a lot of questions. Sorry, someone's like, are there going to be answers to the behavior issue questions? Probably not all of them. So
I think we should just get started on them though.
Yeah.
You're
so
right. Time flies.
Time sure does fly.
Yeah.
So let me and unfortunately, every time we do one of these, you get way more questions than you can reasonably answer, but there are lots of great resources, for example, of cat behavior consultants out there who can also help people with their behavior problems. So I will try to find some questions. Sorry, there's a lot of comments to wade through to find the questions. So someone asked, I think, again, for the Facebook group name. So
I think I'll pop it again once we finish, so it
I did
stays
see
towards the bottom.
a lot of questions about over grooming, and like typically just as a rule of thumb, as a behaviorist, I do not see over grooming clients until the cat has been seen by a dermatologist, unless there's like a really clear stress related issue, which there rarely is. So just so people know, when your cat is over grooming, so that means like giving themselves bald spots or hot spots, the vast majority of those cases do have a dermatological or other medical issue. Psychogenic alopecia, which is hair loss due to psychological reasons is very uncommon. So I would always recommend, seeing a vet. Food allergies can be a big issue. Other environmental allergens can be an issue. And if you're not seeing resolution from your vet, see a dermatologist before you assume it's behavioral, because like I said, the vast majority of those cases, there is an underlying cause. It just may be very hard to find that cause. For most behavior problems, and I guess like the easiest way to answer the questions is to kind of like talk about what we started at the beginning, which is like normal, our typical cat behavior and addressing stress, which is really taking a hard look at your environment and making sure it suits your cat's needs. Do you have enough resources for the number of cats you have? Are they distributed throughout your home so your cats don't have to compete for territory? Do you have things for your cat to do to keep themselves busy? Do they have enrichment? Do they use it? Are you picking the right things for them? And, I feel like, and, we touched on this a little bit, but like we treat some things as essential, right? Like your cat needs food every day, your cat needs water every day, your cat, hopefully you clean their litter box at least once a day. And we kind of expect like those are things that your cat needs to survive. And then the other stuff, even when I use the word enrichment, it kind of implies that it's something bonus and not essential. So a lot of us are moving away from the word enrichment and using terms more like environmental needs, so that it's demonstrated that it's not like your cat needs food and water, but the cat tree is extra, or something you do if you're like, you can, or playtime, right? Like we should exercise our cats every day. That should be part of their basic care, just like feeding them, is to make sure that they get some form of interactive play, exercise, and mental stimulation, whether that's through food puzzles or bird feeders to watch, or windows to sit in, or a catio, or harness training, having a variety of toys, having a box of paper behind you. Like you can see, I have like a lot of cat stuff behind me, but like, making sure that the environment is stimulating for your cat so that they're not just trying to basically cope with the stress by engaging in undesirable behaviors. Certainly, I saw a couple of questions about litter box avoidance. Again, your first step should always be the veterinarian. Most cats who are defecating outside the litter box have a medical problem, vast majority. Urination outside the box is a lot more complicated, but again, I don't typically, as a consultant, take litter box cases unless the cat has had a urinalysis and a full clearance by a veterinarian. So that should always be your first stop when you're seeing sudden change in personality, like like I said, big sign of pain, aggression, especially in a cat who's never been a biter or scratcher before, go to the vet first.
100%.
Yeah.
Would you say that regarding the litter, would you say the same thing if it's just an isolated incident?
Usually I say that my cats get like one freebie, it's like, but is it like, okay, I was out of town, the litter box didn't get scooped that day, or does it seem really random? Depending on the cat, I might not wait. So if it was a 14-year-old cat who hadn't been seen by a vet in a while, I'm going to the vet right away. I'm not waiting. So but most cats will, if you give them a box that's large enough, it's clean enough, it has a sandy unscented litter, it's in a place where they feel safe using it, they have choices. So again, hopefully multiple boxes, especially if you have multiple cats, but the ideal number of boxes is 1 per cat plus 1. Then they should use it. I mean, it's their instinct to eliminate in a sandy substrate. So usually as long as we give them something that works for them, they will have very high compliance. It's really when we stray from that, we use robots or very tiny boxes, or they're covered, or they're in the garage or in the basement or in a closet, you're making it very difficult for your cat to access and use it, then that's when we see a lot of failure to use it.
There's sorry, just to touch a point on the mental enrichment. I know it was a little bit ago, but we did mention playtime to try and help stimulate your cat's mind. But if you don't have that time, say you're away, there are other ways that you can mentally enrich your cat other than having like furniture, which climbing and doing those things are mentally enriching for cats. Even people watching, like if you have a window perch, that is also mentally enriching for cats. But there's something called cat TV. So, but be careful with cat TV. So what I do if I know that I'm going to work for a long periods of time, I've got a mini projector and I put cat TV on the wall. I won't put it on my TV because the cat is going to go at it.
Yeah.
I learned that the hard way. Yeah, but be careful with cat TV and things like laser pointers, because it's a great way to keep the cat entertained for a period of time. There will be frustration that builds up afterwards when the cat can't actually physically grab 100%. Anything.
Yeah.
So what I do is if I have like half an hour of cat TV, I would then quickly get the one toy out, the dental wand out, and let him chase it and bite it and grab onto it. Same thing with lasers. Also a nice way of mentally enriching without you doing anything is getting a food puzzle. So you just give it, instead of putting the cat's food in a bowl, put it into a food puzzle. It will let the cat work for the food, it will mentally enrich them, and it will help with weight management as well.
Absolutely. All right, well, I actually have to go because I have another meeting. And I apologize to those of you who we did not answer your questions. I saw there were some questions about aggression, biting, and like start with your vet, work with a behaviorist. There's lots of qualified veterinary behaviorists and applied animal behaviorists out there who can help you. So, you know, a lot of times you need professional help, like just go to the pros, get help. That's going to be much more effective in the long run to intervene early and be proactive when you can. I want to thank everyone for sticking with us and for all the great questions. Hopefully we'll be back again before long. Victor, it's been really nice to hang out with you.
Likewise, Michael. Likewise.
So excited about the dental wand. I can't wait to get mine. All right. Well, thanks everybody. And thanks to Base Paws for hosting us.
Thank you, Base Paws.
Yeah. Okay. All right. Thanks everybody.